Hello, my name is Helen Torres, and this week I will be doing assignment number 7. For this week I picked the movie Sylvia. The reason why I picked that movie was because I watched it before and I found it very interesting and fascinated. I really like the way this movie portrays how depression works and how it may affect the person's behavior. So that's why I picked this movie to explain the different kinds of treatment that the person may receive while she has depression. So I'm going to explain a little bit about the movie. In this movie, Sylvia, she she is a writer. Uh, Actually, this movie is based on a true story, so I'm gonna say a little bit more about her story. She was born in Boston in the year of 1932. She had like a very precious talent for writing. She was a poet. She published her first poem when she was only 8 years old, which was very fascinating, and I think it's something that I may point about her personality, the way she was, because you can see that she was a very sensitive person and a very smart person as well. She began studying at Smith College. She won a scholarship, and while she was there, even though she wasn't a standing student, she tried to become suicide. She tried to kill herself. She took some pills. This time she survived, but due to her depression, the way she was feeling about herself, she tried to commit suicide. So that's the first sign that we see there. One thing that we know about depression, depression is a disease that rarely is cured. We can get treatment, we can receive therapies to make it better, but it's very hard for this disease to be cured. Actually, people that suffer from depression, they have depression again later on their life, especially when the depression is not treated. So I think we can say that depression is kind of a chronic disease that need to be very careful treated, because sometimes people they don't pay attention to some details, and people they don't we say that they don't take in consideration people that have depressions, and that's why so many people end up committing suicide later on, because they were not treated at the proper moment or at the right moment, as I may say. In her junior year, she, like I said before, she became very depressed and she attempted suicide. As I see in the movie, maybe she felt a lot of pressure, or she was feeling very bad about herself. That's why she decided to take that step, and she didn't have the right guidance at that moment. In the year of 1955, she received a scholarship, and she went to England. And she started studying at the University of Cambridge, where she met Jack Hodness, who was her husband. Later on, they got married. They fell in love, obviously, and they got married. One thing that I think is very interesting in this movie is that while she was in the marriage, she started noticing that her husband was acting differently. She started noticing that her husband was cheating on her. And one of the episodes of the scenes of the movie, I saw how, like, when she discovered that he was cheating on her, how was the reaction of her husband. He was like, yes, I'm cheating on you, and it's very good. that made her feel very, at that moment I know that she felt very down, and she felt very sad about herself because for what I can see in this relationship, she gave up a lot of stuff. She was giving classes at the university, or she was being a teacher, one thing that she didn't want to do, but she was doing it because it was the best thing to do for her relationship at that moment. She was giving the chance for her husband to grow because they were both poets, and instead she was taking that opportunity off from her, and she was teaching. So at that moment, when she saw that her husband was cheating on her, she felt very sad because she felt like everything that she was doing was in vain. She was investing in a relationship that um, was not giving any fruits. It was actually bringing pain to herself, and I think that that's one of the ones uh, that made her depression worse and made her feel uh, really bad about herself and about her as a human being. So that's those type of situations can affect anybody's life, but especially a person who is suffering from depression may take this type of situation that we have, like we see every day, that we may go through every day. They deal with that type of situation differently than a person that is healthy, mentally healthy. This type of person, they take it really personal. They believe that it's all their fault. They believe that there is something wrong with them. That's why the other person is doing that to them, and that's what causes is that depression becomes very aggravated, and in some cases the person doesn't know how to deal with that, and that's why they try to kill themselves, or they try to end their life, because they believe that that's the only solution that they have to take the pain away or to make their life better. um, Another thing is that another thing that portrays how she was very depressed, that she became very passionate for death. She became very interested for death. That's one of the novels, like solo novels that she wrote, that is called one moment. It's called the Bell Jar, and that novel specifically shows a lot of her depression, because she talks a lot about death. She talks a lot about how life is dark, and so she portrays this type of phenomenons of life and death, and how life is dark, and how life is horrible, and how death can mean so much for some other people. And this novel that became very famous, she portrays all the pain and everything that she was feeling at that moment, or she was feeling through her life, especially in that moment when she found out that she was being betrayed by her husband. So later on, she became pregnant. We can say as well that when women, sometimes when they have a pregnancy, they can have I mean, it's not common, but like there is a percentage of women that become depressed. It's called postpartum depression, and I think that she also had that type of depression after she gave birth of after she gave birth. And then that's one thing that affected her as well, because she didn't have the support of her husband while she was still taking care of her little child. She was needed of help, needed of support, emotional support. She found out that her husband was cheating on her again with another woman, and that made her feel very bad once again about herself. This movie is very sad because at the end she ended up killing herself at the age of 30. She was still young woman. She left her daughter alone, and for her life was end because her husband left her for another woman, and she couldn't handle it. She got into a very deep depression, and she couldn't handle the pain, and the only solution that she found was killing herself. I think that in this type of cases, having a guidance, knowing what to do is very important, because we can avoid this type of situations. I believe that if she had like a proper guidance, or she had like some type of advice from somebody to go to a therapist, to seek a doctor treatment, this wouldn't happen. But unfortunately, she didn't have that. Even sometimes when people that have treatment, they end up killing themselves. So I believe that it's something, depression is something that it has to be treated very carefully, and it can never be like seen as something that is not important, because depression is a disease, and I believe that depression affects a lot of people every day, and that a lot of people, they kill themselves because they don't know what else they can do. So I believe that there are several treatments for to treat depression. One of the treatments that we see is a pharmacology treatment that is based on, especially on medications. I believe that this type of treatment is should be used especially when the person is very depressed. The criterion adopted for considering psychopharmacology is actually severe depression, as I said before. In the Hamilton Depression Scale score, the score must vary less than it must be higher than 24, which the clinical literature suggests that may require either pharmacotherapy or a combination of psychotherapy and drug therapy. Some depressed patients may not achieve an adequate response to this treatment, as noted that every individual is different and every individual reacts to treatments in a different way. I believe that this therapy can be very good, I mean, in some cases, but sometimes medications are not the only thing that the person suffering from depression may need. The person suffering from depression always and mostly needs therapy as well, guidance, somebody to understand the pain that they're going through, somebody to guide their life, to map, what they need to do and what is best for them, because these persons are very lost. Of course, the pharmacotherapy can make the symptoms of depression less aware, or can make the symptoms of depression better for the person. Because it's a chemical, because it works with the chemicals in our brains, so it may help to balance our feelings and the way we feel and the way we see life. So of course that may help, but also we need a guidance. We need a psychotherapy to help this person understand how important is for them to go out and to stand up for themselves, and to stop being or feeling the way they're feeling. Of course, it's very easy to say, but it's something that it's going to take time. It's going to take several therapies in order to be cured, and in order to be in order for the person to be able to start a regular or a normal life, like I said. One thing that I must point as well is that in order to be eligible for psychopharmacology, the person must fulfill the DSM-5 criteria for major depression, as well as score more than 24 on the baseline 17 on Hamilton Depression Scale rating. Of course, that those things may vary, but pretty much this is the criteria in order for the person to qualify for this type of treatments. And then we have psychological treatment. We have different types of psychological treatment. We have the cognitive behavior therapy, the interpersonal therapy, and there is like I would say positive psychology, psychotherapies, counseling. There are different types of therapies that the person may benefit. Here I have this book about cognitive psychology that is, I read it and it's very interesting, and I think that in this case, in this specific case of Sylvia, she may benefit, she may have benefit from this type of therapy. So we can say that cognitive behavior therapy is actually help people suffering from depression, particularly non-melancholic depression. We often have an outgoing negative view about themselves. People they don't see themselves as being good, and the world around them, they don't see it as being good. This negative way of thinking is often not confined to depression, but is an ongoing part of how the person thinks about them. So it's something that may need to be changed in order for the person to undergo depression, and in order for the person to overcome depression. So cognitive behavior therapy aims to show people how their thinking affects their mood, and to teach them to think in a less negative way about life, in particular, and themselves. Which I think that in this specific case for Sylvia, it would have been very, very good, because instead of only receiving pharmacology therapy, receiving this type of therapy would have been very benefit for her, because it will help her understand and overcome the fear that she had about life, about people, because we can say that this is all fear, because when we feel bad about themselves, when we feel bad about life and the world, and we don't want to interact with the outside world, is because we are afraid of being rejected. So I think that this type of therapy will have helped her to overcome this fear and to understand herself better as well, and to find some coping strategies to deal with the negative thinking that she had. Another type of therapy is, of course, the therapies that we are studying is family therapies. And the family therapies in depression, they are based pretty much in helping the family, and is based on the following concept. They see the illness, that the depression as an illness may be affecting one person of the family, but in the long run it can affect the whole family. So that's why it's very important to be treated and to understand this type of this person, in order to avoid it to go through another members of the family, and to affect the flow of the family. Family therapists, they believe that any change in one member of the family affects the whole family structure, as I said before. Health professionals that decided to use family system models in caring for people, I was considered the whole family, because they see everyone as an important part of the recovery of the person that is suffering, from the illness, in this case depression. So including every member of the family is kind of like making for helping. It's kind of creating a way of helping this member of the family that is being affected to understand and to start like, how can I say, to start understanding that life is not the way they see. So family support in this type of cases is very, very important, as I mentioned before, because having our family in our side is always good, because we are made of social interactions and family interaction. I believe that our family is the base for everything. So when we have a good relationship with our family, when we have the support of our family, we are able to overcome any type of problems that we may have later on. And one thing that I may mention about Sylvia is that she lost her father when she was only 8 years old, which affected her very, very much, and she only had her mother. But in this case, having a therapy together with her mother and her, I think could have benefited her in many, many ways, because her mother would have been able to understand that what she needed, understand the way she was feeling, and help her in many ways. So during therapy, family therapists, they always use the family strengths to help handle their problems. So all members of the family, they take responsibilities for their problems. Some families members may need to change their behavior more than others, of course. That's why another thing that I would like to mention is that another way of treating depression is the biomedical approach. The biomedical approach is very, very interesting, because they make the patient believe that they're being treated with the medication, but in fact they are not. So there are studies that shows that people that were prescribed placebo medication, they start having a different functioning on the frontal cortex of the brain, meaning that they starting getting better from depression by themselves. They starting healing by themselves, just by believing that they were taking medication. So I believe that this type of approach can be good too in cases where the patient believes that medication is the only way that they're going to be able to get out of depression. So using this type of approach is going to help them heal, without the use of this type of drugs that sometimes have a lot of side effects, and the person is, in some cases, is able to recover themselves, is able to heal themselves, because I believe that all of us, we have that power in our mind. So for now, this treatment, the treatment that I like the best and is the family therapy approach and the cognitive approach, because they are more focused on a person. They are more focused, and the family therapy approach is focused on the family without the use of the medication. I believe that combining some therapy together with the biomedical approach can be very, very beneficial for the patient, instead of using the pharmacotherapy, because patients, they may get addicted to these medications, and they may become very dependent on the medication, and then when they don't have the medication, they may feel like they're depressed or they cannot do anything, and in fact it's not that way. Of course, there is some cases that the medication is needed, is necessary, but I believe that in cases that we don't need it, I think that the best approach is therapy. And because it helps the person, you know, create coping strategies that is going to help them with depression and with every aspect of their life. So I have finished my video for today. I hope that all of you guys like it, and I hope that it was clear. I use this book, Cognitive Psychology, in order to research for some information. I think it was very, very interesting. So I hope that you guys like it, and I hope that you guys have a wonderful day. Thank you so much.